Dentistry is screwing this one thing up, and it's a huge nightmare. I have a bee in my bonnet right now. I just posted a reel about how important it is to go see the dentist at an early age to get your airway evaluated, because we are in a massive sleep apnea epidemic. And I'm going to tell you a story that I am so passionate about, because my own kid got screwed over by dentistry looking the other way. And she has a tiny airway that I'm completely having to rework now on a teenager, which is way more complicated, so that she is not destined to be in a CPAP her whole life. Because nobody looked at her airway when they did her orthodontics, and she's been seeing the best orthodontists that were trying to please me from the get-go, like literally from age 6, 7. We started pretty young. We should be starting at 3, but at that time I didn't know it. Anyway, I posted this reel, and this dentist, who's an instructor, a clinical instructor at one of our technically best institutions in the United States for continuing ed for dentistry, but they're very focused on occlusion and reconstructions and that whole side of dentistry. He said airway dentistry is outside of dentistry scope, and I should send the patient to a sleep MD. Meanwhile, I do send every patient to a sleep MD to get their sleep study read, to get a diagnosis of sleep apnea, which I am not allowed and I do not diagnose, and then I get them to give me treatment recommendations. And airway aware sleep doctors, which so many of them now are so aware, they realize that we need to be doing expansion, we need to be improving tongue space, we need to be improving tongue posture, and that structurally what we do in dentistry is going to impact the airway. So we can either do it right or we can do it wrong, and patients will actually end up with apnea because we didn't give them enough forward growth. We pushed all the teeth back, or we pulled teeth, we made the tongue space too small, and now their tongue is hanging out the back of their mouth and into their airway, so they have 2 millimeters of airway behind their soft palate, like someone I know. So if you're gonna come on my page and say, airway dentistry is outside of our scope, then go ahead and tell all your patients to get on a CPAP. And go ahead and join the many dentists that are screwing this up and ruining faces and ruining airways. I am so over this. If you care about your kid's airway, you care about them sleeping well, you want them breathing through your nose, be careful who you go see. Because some of these guys, they know nothing and they think they know everything, and they're out there spreading the word that this is outside of dentistry scope. That is the mentality that got us into this pickle where we are literally ruining faces every day. I'm so over it. Go find an airway aware dentist. Don't be afraid to travel. There aren't a lot of us, and it's worth every penny. We're not charging more than anyone else. We're doing orthodontics in a way where we make sure that your kid can breathe and isn't going to be strapped to a CPAP the rest of their life. Okay?